An inquest into the death of a man behind bars at the Hamilton Wentworth Detention Center has led to a series of recommendations to prevent future tragedies. Among them, a bias training for both correctional staff and the healthcare providers who treat those in custody. Roger Collins joins us live with more. Roger.
Good evening, Eric. Zakary Rogers was 26 when he died of what we now know was myocarditis, an infection in the heart. And while it's taken years for that fact to be officially acknowledged, his family says they're relieved. But in the wake of this inquest, experts are raising bigger questions about the level of care people actually receive behind bars. The inquest into Zakary Rogers' death at the Barton Street Jail back in 2021 has concluded. With it, the official acknowledgement of his cause of death being myocarditis. Some of those recommendations aimed at preventing tragedies like this include monthly audits on the jail's observation logs, improved communication between Hamilton Health Science workers and detention center staff, and bias training for both, specifically to reduce prejudice when dealing with people who have used drugs in the past, have been diagnosed with a substance use disorder, have gotten treatment for a drug overdose, or are experiencing homelessness.
I wasn't surprised. I think it's, something that we know about healthcare and about sort of the treatment of both people who use drugs and people who have experienced incarceration is that there's stigma associated with both communities. And so I think we know that this impacts people's healthcare, and certainly I think any initiative to try to reduce that stigma with further training is going to serve this population of people very well.
Lennox, a former doctor herself who specialized in addiction medicine, says while people can sometimes get the right kind of help that they need in jail, it's what happens when they're released that's often most detrimental.
But oftentimes, the second they leave the jail, those medications are stopped. There's no effort to make sure that they have a family doctor or a care provider who's going to be able to continue their care. And so we really need to think about, for this group of people, thinking about time in incarceration is just one chapter of their care, but we need to make sure that we're actually working on those transitions to make sure that they're safe, because right now we're essentially just leaving people stranded, and that's where we're seeing a huge drop-off in health outcomes is in that immediate, first few weeks after leaving jail.